Hello and welcome to the webinar. Thank you for joining us today to learn about regenerative medicine, stem cell therapy, and other advanced options. In order to get all the information down, you're going to want to have a pen or paper or your cell phone or tablet to take notes on. So let's get started. How many of you have something that you're hoping regenerative medicine can help you with? Well, the good news is that today you're going to learn not only how to feel better, but how to potentially break that never-ending pain cycle and get out of pain and get your life back. Our purpose is to help as many people as possible get out of pain, stay out of pain, and maximize your health for the rest of your life. Now, regenerative medicine is a new way of thinking about how you can take care of joint problems that you may have going on right now. Typically, drugs and surgery are the option. But those are called degenerative therapies, meaning that they erode and destroy joints. They don't stop the destruction from happening, and this leads to pain and immobility. Now, stem cell therapy is regenerative medicine. You have the ability to regenerate and regrow the tissue in your joints that's broken down or worn out from injury or over time. Stem cells are called the body's master cells. They're the cells that made your body the very first time you were growing inside your mom. They can actually become new cells. What's amazing is that stem cells can become new cartilage, new ligaments. They can regenerate your bones, your nerves, even brain cells, and every organ cell in your body, like your heart, your kidneys, your lungs. It's incredible, this technology, and it exists right inside of you right now. Now, stem cells don't just mask your symptoms. So those of you out there that have knee pain, you're probably aware that what's breaking down is the cartilage, that cushion in between your joints. And stem cells don't just take away pain, they help to regenerate, bring new life back to that cartilage so that you have that cushion back in your knees again. You have the ability to get those joints to move like they once did. Now, once your body starts to degenerate, it doesn't stop unless you regenerate it. So if you think about the area of your body that bothers you the most, whether it's your neck or your back, or maybe it is your knees, whatever's bothering you, there was a time in your life that you injured that area of your body. Maybe it was a slip or a fall, maybe it was a car accident or a sports injury, but from that moment on, that joint or those joints have been breaking down. Whether you felt pain or not, they've been breaking down and wearing out, and now you're to the point where you're in constant pain. Well, the good news is that something can be done about it, and it's your choice. You can choose to regenerate your body. So now we're going to do a brief survey of different body parts that you may be having trouble with. So I want you to make a list for yourself so that you can really appreciate and understand why you're feeling like you're feeling. So if you have problems with your knees, put that on your list. Whether they're achy or creaky or stiff, or whether they give out or you can't even walk because they hurt so badly, put those on your list. So if your low back is bothering you, if it's hard to bend, if it's so painful that you have pain down your legs, if you have difficulty walking because your back hurts so badly, put that on the list. My point is, whatever joints are bothering you, whether it's a little bit or a lot, put those down on the list so you can see how many different areas are contributing to the problems that you have. Now, if you decide to come into the office, we're going to evaluate the cause of each one of those areas that you have pain in and help you understand how they may or may not fit together. So let's take a look at some x-rays that may be familiar to you. On the left side of your screen, you'll see a normal knee joint with a nice big dark space in between the bones where the cartilage sits. On the right-hand side, though, you'll see an x-ray that might look something like yours, where the bones are touching. That may be called bone on bone. Your doctor might have used a term like that. Now, traditional doctors, which we're calling degenerative doctors, meaning they utilize treatments that don't regenerate the joint, traditional doctors are going to recommend pain medicine, anti-inflammatories, maybe even steroid injections to treat the pain that you're having. But what this does is it allows the destruction of the joint to continue. Your problem will get worse. Now, when you come to a doctor who uses regenerative medicine, we're most likely going to recommend stem cell therapy or other regenerative options to regrow the tissue and bring that joint back to life. Let's take a listen to what Hub Arkish says about his stem cell therapy.
I had surgeries on both my knees. I've had back surgery. I've had elbow surgery. I've had a lot of surgery.
Wow.
And the knees in particular, though, I had been to several doctors who'd recommended complete knee replacements, and I said, no, I'm not going to do that. But I also reached the point where I couldn't go much further. And I heard about Dr. Howe and her treatment, and I had stem cell injections in both knees. It's a little over a year ago now. The left knee is 100% pain-free. The right knee, I'll tell you, there's still the occasional bump grind, but considering it was about a 9.5 or a 10 when we started, it's probably about a 1.5 or a 2 on the pain scale now. It's just tremendous success.
Thank you, Hub. So now let's take a look at what your back might look like. On the left side of your screen is a normal, healthy back. In between those bones is the shock absorber of the spine called the discs. But on the right, you'll see an x-ray that may look all too familiar to you. You'll see that the discs lower down in the screen are degenerated, the bones are too close together, and there's even shifting of the lowest bone in the spine, and that can cause significant pain and weakness down the legs and in the back. So which back do you want to live with? I hope it's the one on the left. Let's get your back functioning like it should again. So now listen to what Surasham has to say about his stem cell therapy.
When I had all the pain, I contacted my physician to see, is it okay to go ahead and try the stem cell therapy? And he said, go ahead, it's supposed to work. The staffs were wonderful. They explained to me how it is done, when it is done, and what are the pre-treatment and the post-therapy and everything. And within an hour, I was done. I went home, walking, jogging, all these things I want to do, traveling without pain, without worries, and this has helped me a lot. My life has changed completely. I can sleep much better. I used to take Tylenol, Advil, whatever I had it, to get rid of the pain every night. Now I don't take anything at all. When I started having the pain level went up to 8. And after the treatment, my pain level is less than 1.
Thank you, Surasham. So let's look at another joint, your hip joints. If you have a problem with your hip joint, you're probably wishing that you had a joint that looks like the one on the left-hand side of your screen. That is a normal hip joint, a big space between the ball and the socket to allow for normal motion when you walk and move and bend. But if your hip looks like the one on the right where it says degenerative hip, you know all too well how much pain and discomfort and abnormal motion you go through on a daily basis. It's exhausting and it wears you out, and it won't get any better unless you decide to regenerate it. Now let's listen to what Chuck has to say about his regenerative medicine experience.
Well, when I first got the first treatment from stem cell, I was so impressed that I ended up doing each and every joint in my body. And part of that was I had football injuries and rotator cuff injuries. So by treating all these, I was able to get better movement, get my muscle tone back in alignment, get my spine back in alignment, so that the whole body was more attuned and balanced, and that just accentuated the healing process.
Thank you, Chuck. So let's look at another joint, the shoulder joint. On the left-hand side of your screen, you'll see a normal shoulder where there's a big space between the ball and the socket. It allows for nice, easy movement, pain-free range of motion. You can put your jacket on, you can reach for something without any pain. But if your shoulder looks like the one on the right, unfortunately, you're probably experiencing significant reduction of range of motion, means it's hard for your body to move, and when you do move, if you do move, you feel a lot of pain and pressure in that area. The good news is you don't have to live like that anymore. So, how long have you had your problem? Really look back at the last time you felt well. Has it been a year? Has it been 10 years? Has it been more than 20 years? The good news is today can be the day that you decide to end that pain. The longer you have the problem, the worse it's getting. Now, how often do you get your pain? Is it, like most of our patients, every single day? With every movement that you do, or even worse, you don't know when it's going to happen and it just sneaks up on you. Do you feel pain every time you try to use that joint? Do you feel pain? That's a sign that things are getting worse. Now is the time to take action. When it's at its worst, how does it affect your life? Is it hard just to get out of bed or to get up from a chair? Is it making you have to avoid things that you like to do, like hobbies or certain activities? Can you not stand in the kitchen to cook anymore like you once enjoyed? The good news is the technology is there to help you change that today. Have you become discouraged? Have you followed everything that your doctors have said? You've done the therapy, you've taken the medicine, maybe you don't want to have surgery like a lot of patients that we meet. Well, again, this is something that you owe it to yourself to check out because there are other options. Has your doctor ever told you that you just have to live with it, that there's nothing that can be done about it? It's your age, it's the weather. Well, the good news is that you're not just getting older. It's not the weather. There's a problem there, and we need to find out what the cause of your problem is. Arthritis doesn't just happen over time. You can only get arthritis because you've injured a joint, and from that point you injured it on, it's been degenerating and broken down. Now, I'm not here today presenting this workshop just so that you can listen to me talk. I'm here today to help you so that you can get to a point where you can take action and do something to help yourself. Now, how many of you out there, if you could get a brand new you, would want to? Now, I'm not talking about getting rid of anything that you like, but I'm just talking about getting rid of the parts of your body that aren't working like they should anymore. The parts that are causing you undue pain and suffering and making your life miserable. Now there is a chance for you to get a brand new you. Now let's look at your car for a second. Let's get away from the body. Let's look at your car for a second. How many of you, if you saw that check engine soon light come on in your car, would just cover it up with duct tape and keep driving? I know that's silly, but that's what you're doing when you just medicate a pain. When you have pain and you get an injection of cortisone, or you take a pain reliever or an anti-inflammatory, is that really fixing the cause of the problem that you have? I think we could both agree that it's not. And what's happening is that joint, that area of your body that's bothering you, it's continuing to break down and degenerate, which means down the road, more pain. Sometimes to the point where those medicines, they're not even working anymore. The truth is that pain is a warning sign. It means something's wrong. Just like when that light goes on in your car, service engine soon doesn't just come on because it's Wednesday. It comes on because there's a problem in your car. So you owe it to yourself to look and find out what's causing that problem. You'd check your car, I know you would, even if it costs money. So don't you think that your body deserves at least as much attention, if not more, than your car? I hope, like most of our patients, that you agree with that statement, because that's the thing that's going to help you decide, you know what, I'm done with this. I'm done suffering. I'm done waiting. I need to do something about this problem. So what are your options? Well, first of all, you could keep doing what you've been doing and hope maybe that something different happens. You could actually take more medicine. Most people say, I don't want to take more medicine. It's not helping me right now as it is. You could have more surgery. Many of you out there have already had surgery, and so you know what it's like to recover from that, and you know the limitations that you have following a surgery. That's your option. If you decide to do one of those three things, you can. But if you're like many people and you're tired of expecting good results and getting bad ones, then you owe it to yourself to look at regenerative medicine and turn back the hands of time. Some of us can remember being teenagers and being able to eat what we want, stay up as late as we want, and heal so quickly when we injured ourselves. We want to help get you back to that point in time where your body is working like it should. You don't have to think about it when you stand up. Are my legs going to support me? Are they going to give out? Am I going to be in pain? You don't have to worry about, am I going to be able to make it from here to the car without slipping or falling? Your body works like it should. That's what we want to get back for you. So let's look at different options. The first one we're going to look at is surgery. So on your screen, you'll see a picture of a knee surgery, and the silver part at the top picture is where they have cut off, the doctors have cut off the top part of the knee and pounded in a new artificial knee joint. And the same with the white part on the bottom. Now, as you can imagine, this can be quite painful. And there's at least 3 to 6 months of rehab following a surgery like this so that you can learn to use this new knee joint again properly. Now, the truth is, replaced joints, they don't last forever, maybe 10 to 12 years. So you really have to ask yourself, if this is the route you choose, how much longer do I want to live? And figure out how many more times you're going to have to go through that surgery. Now, we know the more times you injure an area or cut it open, that it gets weaker and it gets harder to heal. So if you decide that this is the route that you're going to go, you need to really look at all the different options. But if like many of our patients, you realize, I don't think I want to do that, especially not now that I know that there's something else, well, the good news is that you now have a choice. You can choose surgery, or you can choose to regenerate the body that you have right now. Now, the other question you have to ask yourself about surgery is, am I willing to pay the cost of lost time and function and the pain and suffering that people go through following surgery? That's a significant question to know the answer to before you decide to go down that road. Now, as you know, all surgery has risks. Bleeding problems, blood clots, infections. The Journal of Orthopedic Medicine says that 1 in 400 people die within 30 days following a total knee replacement. Now, if you make it through, you might be looking at a lifetime or a long period of time of medication, like narcotics, which are highly addictive, or non-steroidal anti-inflammatory drugs like ibuprofen or Advil to manage your pain, possibly even muscle relaxers. Again, something to consider when you're looking at your options. So how many of you out there have had spinal surgery? That's the picture that you're looking at right now. Now, it is bloody and gory, and I want you to understand everything that's involved so you can choose whether or not this seems like the right solution for you. So in surgery, what doctors are looking to do is to stabilize the areas of the spine that are moving abnormally. So they'll take two individual bones and they'll fuse them together, which limits the motion in that area. So then if you ask yourself, well, where does the motion come from after that? It's above that area and below that area, which ultimately leads to abnormal wear and tear of those areas, and you guessed it, more spinal surgery. So one surgery usually leads to more and more surgeries, and you have to look at that if you're considering that option. Now we have another option for you. We have this technology called regenerative medicine that is helping hundreds of thousands of people eliminate back pain, and it could help you. If you have shoulder pain out there and you're considering surgery, you need to know these facts. The cost of surgery is between $5,300 and $22,000, much of it coming from the rehab that's needed following surgery, and usually you need more than what's originally recommended. Shoulder surgery requires 6 to 12 months of rehab following the procedure, and as you can imagine, it's quite painful to get a new shoulder. The success rate of this surgery is less than 50%. If that's a risk that you're willing to take, then that might be what you want to do. But if, like many people that have come to us and said, I don't want to have my shoulder cut open, but I need my motion back, I need my function back, then regenerative medicine is probably for you as well. Some of you out there may be thinking, okay, I don't want to do surgery, but I have this pain and I don't know what to do, so I'm using pain medicine. Well, this slide shows many different options for pain medicine, but all pain medicine does have side effects, like all medicine has side effects. Unfortunately, with pain medicine, the biggest side effect is stomach issues and bleeding, and 10 to 20,000 people plus die every year from taking this medicine over and over and over again for pain. And if you think about it, it's like putting the bucket under the leak in your roof instead of fixing the leak. The choice is yours. Fix the problem or treat the symptom and allow the problem to continue. So you might have already tried cortisone as a means to treat your pain. Cortisone is a very powerful anti-inflammatory, like the pain medicine that we just talked about, that can destroy your liver and your kidneys. Cortisone can give you relief in the joint it's injected in, but it can also speed up the destruction of that joint. So it's not a cure-all, it doesn't regenerate the joint, it may give you pain relief, but there is a limit to the number of injections you can have per year. So let's look at what stem cells are. This slide shows in the middle a stem cell. And what stem cells do, if you follow the arrow to the left, is they reduce inflammation. They're attracted to inflammation. How do you know you have inflammation? Well, if you have pain, stiffness, swelling in a joint or in an area of your body, that's inflammation. And like it says on the screen, the key to taking away your pain is to eliminate inflammation. And that's what stem cells start to do. They're attracted to inflammation, they reduce the inflammation, then following around, they help to clear up any dead or decaying material in the joint. It says it fights cell death. And then continuing on to the right, what the stem cells do is they then regenerate whatever tissue that the joint needs, whether it's muscle or bone or ligaments or tendon or even cartilage. And then the stem cells regenerate themselves. And this cycle continues again and again and again until that joint is regenerated. And then the stem cells stop regenerating that joint and you have a new healthy joint. Now, once the cells are injected into your body, they become part of you. So they last as long as you're alive. So once you regenerate the joint, it's yours for the rest of your life. In the United States, there are both surgical and non-surgical options for harvesting cells used in regenerative medicine. So first we'll talk about the surgical options. The first one is harvesting bone marrow stem cells from your own bone marrow, and that's done from your hip. Now that is a surgical procedure, there's some discomfort to it, but those cells are extremely useful for specific types of problems. The second surgical option is harvesting adipose tissue. That means belly fat. A lot of people like that one because they think, you'll take the belly fat from my middle and you'll put it in my knees and I'll look better and I'll feel better. But the truth is, we only take about 2 D-sized batteries worth of fat. So you won't look that much different, but it will help your body function and feel better. So the next options we're going to talk about are non-surgical. The first one is from what's called amniotic tissue. So when a woman has a baby, the baby grows in a sac called the placenta. And after a woman gives birth, the baby is healthy and the sac gets thrown away. So it's considered medical waste at the hospital. Well, we work with different tissue banks across the country who can actually harvest cells from that sac once the baby is born. Now, this has nothing to do with Planned Parenthood or anything to do with the baby. It's literally just medical waste that can be turned into something that could help regenerate your joints. So it's something that a woman does to help other people. She donates the placenta once the baby is born. So there are very specific guidelines that are followed by the donors of this tissue. For instance, a woman has to have a C-section, a planned C-section, because the tissue bank wants to make sure that there's minimal damage to the tissue so that the cells are preserved as much as possible so they can help you heal your body. Second is she cannot have any genetic or mental health problems. She can't have any infections or diseases. She can't take any drugs or have any medication. She can't even have a tattoo. So these women undergo a lot of screening to make sure that the tissue that is donated is very useful and safe and effective. Now, the last non-surgical option is umbilical cord cells. And this comes from the umbilical cord of a baby. After the baby's born, the cells are harvested and can be used to regenerate areas of the body. Our medical providers are fluent in all the different options available to treat your health problems, and they'll determine based on your consultation and your exam which source of stem cells is best for you. So you might be wondering, if these stem cells are in the placenta, why don't I have enough stem cells in my body to help me right now? Well, as you can see on this slide, the truth is that when you're younger, you do have a lot of stem cells. And as you get older, the number of stem cells that you have significantly reduces. As you age, your stem cells age too. And they've recycled many, many times in an effort to heal you and regenerate your body up to this point. Now, unfortunately, when you need them the most, you have the least amount and the most fatigued and tired cells that you could possibly have. This graph shows that when you're a baby, you have a significant number of stem cells. And the reason is, if you think about what's a baby's job, what do they do day in and day out? Is they grow their body. Well, by the time you're a teenager and your body's grown, the number of stem cells you have in your body drops tenfold. You don't need all those additional cells because you've already grown the body that you have. Now, you might be looking further out on this chart if you're older than a teenager and found that, wow, if I'm 50, it's 1 in 500,000 cells is a stem cell. If I'm 60, 1 in 1,000,000. If I'm 80, 1 in 2,000,000 cells is a stem cell in my body. How on earth am I going to heal if I need at least the amount I had when I was a teenager in order to keep my body functioning like I want? Well, the answer is we have to increase the number of cells in your body and increase the function of the cells that you have already in your body. So let's look at how we might do that. If we use your cells, if we harvest them from your hip, the bone marrow in your hip, or if we harvest them from your belly fat, the FDA, the Food and Drug Administration, has 2 rules regarding stem cells. Number 1 is we can't change them in any way. We can't add in all those growth factors that you had coursing through your body when you were a teenager that allowed you to heal so fast and eat what you want and have limitless energy. We can't add those back in, and you don't have enough as an adult. The other thing the FDA says is we can't grow out the stem cells and make more. Remember, you had so many more as a teenager and you're lacking so many right now, but if we take your own cells, we can't change them in any way. And remember, the cells that you have, they're tired. They're lazy. They've helped you thus far in your life and they can't do it anymore, or else they would be. Now, the amniotic tissue, it's complete with all the components that you need in order to heal, like the growth factors that you had when you were a teenager that allowed you to heal so fast, but also they have a very unique type of cell in a large amount in the amniotic tissue. It's called a cytokine. So when your knees or your back or your hip started to bother you, it sends out a chemical SOS signal that tells the body, hey, I have trouble here. I have problems with my bone or my joint or my nerve or my muscle, whatever it is. Now, the cytokines in the amniotic tissue, they pick up that chemical message and they tell the stem cells exactly what to make in that area. We don't have to do any of that. You don't have to think about what needs to be made. The stem cells will know based on the cytokines and the information that is given to those cells. And so then the cells go right to that area. They start to regenerate what's needed. And the even better thing is, once that area is regenerated, those cytokines tell the stem cells to stop so that the cells are in your body for a total of 8 to 12 months, and they won't continue to grow unless there is a new injury or trauma to that area. So your knee won't grow as big as your hips or your shoulders. It'll still be the same size as your other knee. It'll just function like it used to. Amniotic stem cell therapy has only been allowed for use in the United States since about 2012. Since that time, there have been more than 1 million injections done without any adverse reactions. People say, how could that possibly be? How could there be no adverse reactions? Well, if you understand the anatomy, on the side of the sac that the baby was growing in, where the baby was growing, the baby doesn't have an immune system. So there's nothing in that tissue that's being administered that your body would reject or react to in a negative way. The baby doesn't have an immune system till it lives outside the mom, so there's no tissue, there's no cells that could cause any type of a reaction in your body. And the other point is that while the FDA approves drugs, the FDA regulates stem cells. So they're in the tissue banks regulating the production and the packaging and the storage of all stem cell and regenerative medicine products. So for repairing your joints, like we talked about before, you don't have enough cells left in your body, or else your body would be repairing itself on its own. So we can't grow your stem cells. If we harvest your stem cells, we can't grow them. We can't make more of your cells here in the United States because the FDA has these guidelines and regulations. We can't add in those growth factors. You don't have them naturally in your body after you're a teenager. You don't have a lot of those cytokines, those cells that tell the stem cells what to make in the area they're injected. And all these factors get worse the older that you get. So if you did choose to use your own cells for joint problems in your body in the United States, you would need, most likely, multiple injections, which means multiple bone marrow biopsies, multiple adipose belly fat tissue harvesting, and while it's not painful, it's not something that you'd want to go through every day. So after your exam and consultation, then the medical provider could make the best recommendation for you as to what type of stem cell therapy or other regenerative medicine procedure is right for you and the conditions that you have. Let's take a look at some of our patient slides showing before and after treatment. On the left side of your screen right now, you'll see a knee that might look something like what yours looks like on x-ray, which is not in very good shape. On the right-hand side, you'll see a knee that's more normal. The space in between the two bones is a dark gray, indicating that there is cartilage present. On the left, it looks more like bone on bone, which is what many of you have heard probably. Now, on this screen, you'll see on the left-hand side of the screen is the patient before they were treated. You'll note the date says October 16, 2015. This particular patient received the amniotic tissue for their knee problems. On the right-hand side, just 8 weeks later, you'll see the change in their joint, that the space between the bones has gotten much bigger. Now, the good news is this is only 8 weeks. The tissue is in the body for a total of 8 to 12 months, so they still have a lot more healing to go. Take a listen at what Terry has to say about his experience with regenerative medicine.
When I completely forget that there's something going on with my hip, we've made it. But that relief is, I got so jacked up when I knew it's in there, it's working, I could feel it working. It just got me jacked. I want to run. Pain does funny things to you. And getting away from pain just opens the door to let your life go again. It's got me jacked up. I'm ready to start training again to the level I was. Being an old man, you learn things. I'm going to be a wiser runner now, and I'm going to have the hip that I had when I was young.
Thank you, Terry. Let's look at another patient's knees here. On the left-hand side, you'll see that we actually measured the space between the joints. On the far left-hand side, you'll see the inside of the joint measures 1.6 millimeters. Not much room. This person was in pain all the time. On the right-hand side of your screen, where the date says October 9th, 2015, you'll notice that same knee measures 2.7 millimeters on the inside of the joint. That's a significant amount of growth in only 9 short weeks. If you look at the outside of the left knee on the before picture, you'll notice that it's 3.22 millimeters. After treatment, the outside of the left knee has increased in space to 4.7 millimeters. Needless to say, this patient is much more comfortable. They stated that they're pain-free and they're starting to enjoy life again. That's what we want for all of you. Here's a patient that had their shoulder treated. On the left-hand side, the patient had only about a half a centimeter of space before they got treated. On the right-hand side, you'll notice the joint almost tripled in space, 1.42 centimeters after treatment, and that was only in 12 weeks. So they were able to get back to the sports that they enjoyed. They could get dressed, they could bend and move and reach as if they never had a shoulder problem. So can you imagine a life of being pain-free, of waking up and getting out of bed without any stiffness or pain or weakness? Can you imagine going downstairs and making your breakfast and having energy and coming upstairs, getting ready, going out for the day with your friends or family, enjoying life, not missing out on the things that you love to do, coming home at night and still having energy? What would that feel like? Well, you won't know unless you decide, like many of our patients, to do something different with your health. And there's an option for you now. You don't have to suffer. Your healing starts with a decision, deciding that you are worth investing in, deciding that today's the day that you're going to make a change, that you're going to do something different, that you're going to take a chance on getting yourself better. You've already tried all these options on the screen. You know they're not giving you the results that you want, so why not look at something different? Why not give yourself the gift of health, the gift of being able to go out and enjoy your friends and family and play with your grandkids and get up and down without pain anymore? That can be the life that you live. You have two choices. Number one is you can keep doing what you've been doing before and unfortunately feeling crummy and getting worse every day. We already talked about how degeneration gets worse every single day. Or number two, an option you've never had before, regenerate your body and start your life again. Start living again. The choice is yours. There's 4 reasons to actually make a decision to do something about getting your body better. Number 1 is you'll only get better if you actually get this treatment. If you get regenerative medicine, that's what starts the healing. Reason number 2 is your best chance to improve is right now. Don't wait. Don't wait till you have a cane or a walker, or you're in a wheelchair, or even worse, you're just confined to your home. That's not living. Life's about happiness and living. The better you feel, the happier you'll be. And it's no longer necessary to suffer. You don't have to suffer. That's a big deal for people to understand. You've probably been told by your doctor, this is as good as it gets. Well, what they should really add is, that's all I know. I don't have any other options, but we do. So what I want you to do is I want you to think about stopping the life of pain, about changing and enjoying life again. Make a decision to get your body healthy. Because there's nothing more important than your health. Not your car, not your house, not a trip that's short-lived. Your family wants you. They want to see you energetic again and enjoying life and doing the things that you love to do. It's hard to watch somebody you care about suffer, and it's no longer necessary. So we want to give you a gift, and that's the gift of health. So please take us up on this opportunity to come into the office and have a free consultation and meet with us and find out what's been going on. We want to know how you got like this. We want to know what you've tried and what results you got. We want to know all about what would you like to do when you feel better. And we'll let you know if we think this is something we can help you with. Now, all you have to do is call the number on your screen to make a free consultation. So please take advantage of this. You owe it to yourself. You owe it to your friends and family. Give yourself the gift of health. And we look forward to seeing you in the office. For your free, no obligation consultation, complete the form on this page or call the number above right now to reserve your spot.